My name is Dr Stephen Pillinger. I'm a colorectal surgeon here at the Sydney Adventist Hospital. Firefly is one of the pieces of technology that we have available with the robot. It is like all of the tools with the robot. It's available at the touch of a button on the surgeon console, which is one of the exciting advances with this Xi robot. Is we can control everything from camera angle to energy source to instrument position, and as you mentioned, Firefly, all from the surgeon console. One of the things with colorectal surgery, and as I say to every single patient who's having an operation, the biggest thing we worry about is the joint in the bowel, the anastomosis. And this is like plumbing. You're joining pipes together. Whenever you join pipes together, you can leak from that joint. And there are a number of factors that contribute to that risk of leak. And one of the most important ones is blood supply. The quality of the blood supply going to the anastomosis or the joint is enormously important, perhaps the most important factor. And there's been huge amounts of work to work out how the best way of working out the blood supply at the anastomosis, from using Dopplers, blood flow monitors, temperature probes, cutting the blood vessel next to the anastomosis to see if it bleeds in a pulsatile fashion. But all of these are indirect measures. With Firefly, what we do is using a dye called indocyanine green, or ICG, which is a benign agent which we inject intravenously at the time when we want to check the perfusion, the quality of the blood flow. We inject the dye, and then using a different wavelength of light, the bowel will then glow green. You can see the blood flowing through the vessels, you can see the pulsatile vessels, and if the bowel glows green, when we do that, we know that it's got a very good blood supply. If it remains dark or grey, then we know there's no blood supply there. And what is surprising when you do this is, when I do it, I always indicate where I think the blood supply is good, and very often it'll be 1 to 2 centimetres away from there where the Firefly proves the blood supply is better. So you've potentially saved a disastrous leak for a patient in that situation, where you are going to make the division of the bowel. You actually do it in a much safer place. Firefly also has other applications, for example in upper GI surgery. It is very good at lighting up bile ducts, so it makes liver and bile duct surgery much safer. In terms, you're far less likely to injure a bile duct because you can see it glowing green with the ICG. So in terms of it's a cool tool, if you like, but much more importantly, it is really a very important adjunct to patient safety and surgical safety. And if you have an anastomotic leak in bowel surgery, for example, that's a disaster, and a patient can be in hospital for months, and really, in some circumstances, will never make a full long-term recovery. So if you can have another tool that helps prevent that outcome and lead to better patient outcomes, then that's very, very important.